Hey, it's Dr. Bill with just the tip of urology school. We're going to talk about epididymitis. I was going to talk about something totally different today, but Jen gave us a request. One of our many students who's not officially enrolled in urology school, but is thinking about it. So we want to make sure that we answer and address Jen's concerns on epididymitis. Very common. We see that a lot. The big differential is to make sure that you're not dealing with a torsion. The history is very different. The exam is very different. Sometimes you have to do some testing to make sure that there's good blood flow. But in general, epididymitis or inflammation of the tubes around the testicle, the epididymis, can be from a variety of sources. One, in guys under 35 years of age, statistically, we see epididymitis as more of a function of a sexually transmitted disease, gonorrhea or chlamydia. We can also see it with enteric infections from normal urinary tract infections. It can also be seen as a function of Foley catheter or intermittent catheter use, so be aware of that. The complaints can be significant. Febrile, burning with urination, irritability associated with a bladder infection, maybe some signs and symptoms of a sexually transmitted disease, recent exposure to a new partner, even urethral discharge. A number of bacteria that we see. Sometimes we can even see this as a function of chronic tuberculosis. So be aware of that in travel to different endemic areas where TB may flourish. On physical exam, it can be associated with a reactive hydrocele fluid around the testicle. The testis itself may not necessarily be tender, but the epididymis, the tubes surrounding inferiorly, posteriorly, and superiorly may not only be thickened, but very tender and warm to touch. In severe cases, you can see fixation of the scrotal contents to the scrotal wall. That can be associated with orchitis and even an abscess of the testis and the epididymis itself. When you have something that you're not bulletproof certain on, get an ultrasound. It will show up the epididymal enlargement and induration nicely. Based on your history, your physical exam, and the demographics, there are IM injections of medications along with PO medications as well, doxycycline, different penicillins, as well as fluoroquinolones. Also symptomatic treatment with scrotal support, sitz baths, and anti-inflammatories are actually good to be are good treatments associated with this kind of malady. On physical exam, also use scrotal elevation. You can often see relief of complaints during your physical exam, and hence the value of scrotal support. Look for any other associated complaints like urinary tract infections as well. Patients should be followed closely to make sure there's improvement. If things progress, rarely do you need hospitalization and IV antibiotics as well. So there are a lot of things that can be done for this. It's pretty common. Mostly you need reassurance to let patients know it's going to improve. Follow them to see what needs to be done and how they're progressing. Dr. Bill with just the tip of urology school discussing Jen's concerns of epididymitis.